Welcome back to OMFS Essentials. There is a guiding principle in surgery: respect the tissue, and it will reward you with uncomplicated healing. Today, we discuss this foundational concept: tissue insult, caused by forceful retraction, rough handling, injudicious dissection, or allowing tissue to dry out, is met with a severe biological reaction. This leads to increased inflammation, delayed healing, tissue necrosis, and a higher chance of infection. We will cover the principles of respecting soft tissue, beginning with the most important step, the incision. 1. The surgical incision. An incision is made with a sharp, barred Parker knife. In OMFS, we commonly use a number 15 blade on a number 3 handle for most incisions. A number 11 blade is a stab knife, used for incision and drainage of abscesses or for gingival crevicular incisions. Note on cautery: skin incisions are not made with an electrocautery knife due to the risk of tissue necrosis and impaired healing. However, cautery is acceptable for deeper tissues and mucosal incisions. Principles of a good incision. 1. Mark the incision. Always mark the intended line with sterile marking ink first to avoid mistakes. 2. Placement, or Langer's lines. The incision should be placed in normal skin folds or along Langer's lines. These are the lines of minimal skin tension. Incising along them minimizes tension, prevents wound dehiscence, and results in a more cosmetic, camouflaged scar. 3. Sufficient length. The incision must be long enough to provide easy, passive access to the deeper structures. A short incision requires forceful retraction, which causes more tissue trauma and inflammation. It is a false notion that short incisions heal faster. Healing is a simultaneous process independent of length. 4. Avoid vital structures. Plan the incision to avoid known major blood vessels and nerves. 5. Hold the knife correctly. The knife is held with a pen grip to provide maximum control. The hand is rested on a stable surface. 6. The stroke. The blade is held perpendicular to the tissue. The assistant stretches the skin taut, and the surgeon makes a single, controlled, continuous stroke through the full thickness of the tissue. Repeated, hesitant, or sketchy incisions lacerate the wound edges and severely compromise healing. 2. Flap designing. When we need broad access, we elevate a flap. This design of the flap is critical for its survival. Base wider than the apex is the cardinal rule. The base of the flap must be wider than its apex to ensure adequate efferent and efferent vascularity. A narrow base compromises blood flow and leads to flap necrosis. Adequate access. The flap must be wide enough to provide passive access without stretching or tearing. Full thickness. The flap should be full thickness, for example, a mucoperiosteal flap that includes the mucosa and periosteum. Rest on sound bone. The edges of the flap must not lie over a bony defect. They must be sutured back onto a solid, healthy bone shelf to prevent the flap from collapsing into the defect and causing wound dehiscence. 3. Tissue dissection. Once the incision is made, we must separate the tissue planes. Sharp dissection. Method: using a knife or the sharp tips of scissors. Pros: this is less traumatic than blunt dissection as it cuts cleanly without tearing. A knife is less traumatic than scissors as scissors crush the tissue before cutting. Cons: it is dangerous to use near vital structures. Blunt dissection. Method: using the non-cutting edge of scissors or the tips of a hemostat in an open and spread motion. Pros: this is the preferred method for soft, friable tissues and for dissecting near anatomical proximity to vital structures, nerves, and vessels. Cautery dissection. Method: using an electrocautery tip. Pros: It provides a dry surgical field by simultaneously cutting and coagulating small vessels. Cons: it inflicts more thermal necrosis or heat damage to the tissue, which can compromise the quality of healing. 4. Tissue retraction. Retraction provides visibility and access. The choice of retractor is key. Atraumatic retraction. For soft, friable tissues, use smooth, atraumatic retractors like the Langenbeck's L retractor. Traumatic retraction. For tough, tenacious tissues like skin, muscle, or periosteum, use holding retractors like Alley's forceps or a cat's paw retractor. Critical precaution. When using an Alley's forceps on a skin flap, never apply it to the outer epidermal surface. This will leave ugly bite marks. It should be applied to the inner or dermal surface of the flap. Specialized retractors. Different tissues require specific tools. Glandular structures, lymph nodes, held with Babcock's gland holding forceps. Fine skin flaps, in plastic surgery, retracted with skin hooks. Nerves, retracted with blunt nerve hooks. Intraoral, Doyen's or Dingman's mouth gags, or an Austin's retractor for third molar surgery. Eyeball, retracted with a copper malleable retractor. Summary. Tissue respect is an active process. It is achieved by making a single, sharp incision along Langer's lines, designing flaps with a base wider than their apex for vascularity, choosing the right dissection method, sharp for clean cuts, blunt for safety near vital structures, using the right retractor, atraumatic for delicate tissue and traumatic for tough tissue, always applied with care.